Ever seen a catheter that looks like this? How about this? In this video, I'll break down some of the most common types of catheters on the market that can make self-catheterization easier. I'll also be making catheter recommendations based on different SCI levels, since function and mobility plays a huge role in what works best. With that, let's dive in. Welcome back to video 5 in the series where we discuss the role of OT and BBM. I'm Julia, and today we're going to talk about all sorts of catheters that are specifically designed to meet your client's specific bladder management needs. What many people don't realize is that most urological medical suppliers offer free samples so that your client can test different options. And the best part, you as an OT can help them navigate this process. If you've worked in an inpatient unit before, you're probably familiar with the classic closed system catheter set that's used by the nursing staff. Once a client is discharged, there are many other catheter options available that can simplify the self-catheterization process. Of course, their options will depend on factors like insurance coverage and client-specific needs, but it's important for them to know that bladder management in everyday life can look way different from what they experience in the hospital. This can be a huge relief if their only exposure has been the aseptic techniques used in inpatient settings, with steps like donning gloves, swiping the area with iodine, and following a lengthy sterile routine. It can be a daunting, time-consuming process, especially considering that they'll have to do this 4 to 6 times a day. By educating clients on their full range of options, we can help make bladder management more manageable, giving them more confidence, increase independence, and maybe even speed up their community reintegration. When considering catheters for individuals with SCI, let's revisit the 3 functional groups that we've discussed in our previous videos. As you recall, we have our C1 to C5 group, typically with absent hand function. Next, the C6 to C8 group with limited hand function. Then our T1 and below group with full hand function. Within the C1 to C5 group, you'll typically see long-term catheterizations options used. Again, this is due to the absence of functional upper extremity movements. This includes indwelling Foley catheters or suprapubic catheters. Alternatively, caregiver-assisted intermittent catheterization, or IC, is also an option. You might see IC with some incomplete C5 injuries, but more often than not, to maximize independence, the indwelling catheter option is the more selected option. For the C6 to C8, some form of wrist extension is present, enabling functional tenodesis. This is a game changer because it allows for the potential for independent, intermittent self-catheterization. The ability to extend the wrist helps with handling of catheter materials, lower extremity management, body positioning, clothing management, and the potential for toilet transfers. As we move towards C8, or consider incomplete injuries, finger and thumb flexion may also return, further improving dexterity and object manipulation. That being said, this is the group that we start to see more options in catheter types and designs. And finally, for T1 and below, full independence and self-catheterization is possible, barring any comorbidities or limiting factors. With full upper extremity function intact, this group has the most catheter options in design and types, giving them the flexibility to choose what best suits their lifestyle and needs. It's important to note that every SCI case is unique, so the information provided here is based on general patterns expected at each functional level. Clinical decision-making should always consider the individual's specific presentation and needs. Now, before we dive into catheter recommendations for each group, I want to explain the different types of catheter options available so that you understand the why behind the recommendations. When we talk about catheters, we typically categorize them by placement, design, size, and material type. Let's start with placement. There are 3 main categories. First, indwelling catheters, which you are probably already familiar with. These are long-term options, like Foley's or suprapubic catheters that stay in place for continuous drainage. Next, we have intermittent catheters, which are single-use catheters that include a wide array of designs. Finally, we have external catheters, which are placed over or up against the urethra, including condom catheters for males or urine collection devices for females. Next up, we have design. 4 main designs I want to talk about include closed system, standard straight tip, coude tip, and compact designs. Now, closed system is how it sounds. The urethral catheter, the part that's inserted into the bladder, is hooked up to a drainage bag. It's considered the most sterile option, and in some cases is in an all-in-one kit that includes gloves, wipes, and all these other items, of course, the catheter itself. A standard straight tip does not have a collection bag, so you can think of this as an open system catheter. A coude tip catheter looks like a straight tip catheter, but if you can look closely, it's angled at the end. This helps with strictures in the urethral tract, such as enlarged prostate glands or stomas. Lastly, we have compact options for both male and female that are convenient for both storage and travel. However, the trade-off for males is that it has a bit of shape memory, requiring a little bit of increased dexterity to help manage the catheter. Now, let's talk catheter material. This is where things like rigidity, flexibility, and lubrication come into play. These are important characteristics because the type of catheter that a client chooses can affect ease of insertion, handling, and comfort. The most common materials you'll encounter are latex, silicone, or polyvinyl chloride, or PVC for short. Latex is the most pliable material and cost-effective. You may have even heard of these referred to as red rubbers. These are great for comfort, but can be difficult to manage with limited dexterity, and there is a risk for allergy. Silicone is probably the most common material and typically used by hospitals. It is latex-free, thin-walled with a wide lumen or diameter, which is great for drainage and sediment passage. Then, with PVC, this one is also latex-free, but it's a little bit more rigid, which is great for handling. The special feature about this material is that it's compatible with something called hydrophilic or water-liking coating, which I'll talk about a little more in a second. So the order of which I describe these three materials is important because they go from most pliable to most rigid in structure. On to lubrication. Catheters can be lubricated using a silicone or water-based gel, or have slick properties caused by the hydrophilic coating that I mentioned earlier. Honestly, lubrication comes down to personal preference and comfort. What matters most to us as OTs is how the lubrication is applied to the catheter. Catheters can come either uncoated or coated. If they're uncoated, this creates an extra step for your client to either apply gel lubricant manually or break a water sachet, which is included in the catheter packaging, to activate the hydrophilic coating. Otherwise, there are ready-to-use pre-coated options in both gel and hydrophilic categories, which eliminate that extra step needed in CIC, or clean intermittent catheterization. All right, one last note on design. Because the urethra is much shorter in females, there's an entire market for smaller female catheters. Females can, of course, continue to use standard unisex catheters, but just know that these compact options are nice for travel and potentially easier for handling while seated over a toilet. All right, now that we've gone over the basics for catheter types, let's go over function-based recommendations for our three main SCI groups. For C1 to C5, really nothing changes here, as we're looking at those long-term indwelling options with caregiver assistance. However, the focus of OT will be making sure that the caregivers are trained on proper bag emptying schedules to prevent complications such as AD or secondary infections. Moving on to individuals with C6 to C8 injuries. With wrist extension and some grip ability being present, a great place to start CIC training is with a closed system design. A closed system design is nice because you don't have to worry about spillage while you're still trying to get the hang of catheterization. If insurance doesn't cover closed systems for your client, a simple workaround is using an extension tube to a leg bag, essentially making a makeshift closed system. Note, specific criteria may make your client eligible for closed system catheters. For example, those who are immunosuppressed or those experiencing recurrent UTIs, which is 2 in a 12-month period. To cater to individuals with limited dexterity, there are some catheters that come with a gripping handle and locking mechanisms for improved advancement of the catheter from the bag into the urethra. With this technology, each forward movement is locked into position, preventing retraction of the tubing back into the bag. When considering materials and lubrication options for this group, ready-to-use catheter options eliminate that step of applying gel, making the process quicker and easier. Also, hydrophilic catheters may be a good option as they are slick and a little bit more on the rigid side, helping guide the catheter up into the bladder. So bringing this back to OT, here we can insert ourselves with education and training on all the supporting elements that enable self-catheterization, like body positioning and seated balance. We can educate clients on different catheter designs and lubrication options, and either continue practicing self-catheterization using closed systems provided by the hospital, or request free samples from urological medical suppliers to practice prior to discharge. And finally, for individuals with injuries at T1 and below, it really comes down to personal preference. This group can also start off with closed system catheters for a less messy practice session, but ultimately, standard straight tip or compact options will likely be their catheter of choice for easy disposal and travel. Again, the OT focus here will be education and training on all of the supporting elements that enable self-catheterization. Okay, that's all we have for your breakdown of catheters and recommendations based on SCI functional groups. For a full breakdown on catheter types and their pros and cons, check out the handout I've linked in the video description below. Join me next time as I discuss different AE to help make bladder management easier for your clients. See you next time.